All right, well, thank you so much. Welcome, everybody. Thank you all for tuning in on a beautiful Tuesday morning. Thank you so much to Web Exercises for giving me the opportunity here to speak to you for the next hour or so. And thank you, David, for that wonderful introduction there. I don't know, David, you make me sound pretty good up here. I might have to take you to all my lectures, presentations, and seminars. Let you be the hype man. Fire up the crowd for me a little bit. And so my name is Dr. Richardson. As David mentioned, you guys call me Donnie, please. I'm not too big into formalities. Plus, we're all the same here today, right? We're all really good experts at what we do. And so I just happen to be the one that gets to speak to you for the next 60 minutes or so. And so we're here today to talk to you about, does your movement match your anatomy? Kind of a new look at how physical rehabilitation should be thought of, and just how to train the human physical body in general, really. For today, this morning, we have in biomechanics what I like to think of as the law of 100% motion. What the law of 100% motion states is any movement produced by the body is said to have 100% motion that's required in order to produce that particular movement. All right, and what this 100% represents is essentially the total workload necessary for my body to generate in order to produce the given movement. And so if I take a quick example, I'm standing up here, hopefully you guys can see me clear enough on your screen, and I do a little movement pattern. Let's say I squat down and stand back up. Well, in order for my body to produce that little squatting movement pattern, it took 100% motion. That 100% represents the total workload necessary for my body to generate in order to produce this little squatting movement pattern. And so that 100% representing the workload is naturally going to get divided up amongst everything I have: muscles, tendons, ligaments, joints, bones, cartilage, fascia, connective tissue, you name it, and by region as well, right? And so I do that little squatting movement pattern, and let's say in this example, the foot and ankle and all the associated anatomical structures down there, muscles, tendons, ligaments, joints, bones, cartilage, everything in that general region, let's say, gives me roughly 10% of the total workload necessary to complete this motion. The knee and all those anatomical structures there, they're going to give me another 20%. The hip gives me another 30%. The back kicks another 10, so on and so forth until 100% is reached and the movement is actually produced. Well, now let's say, for whatever reason, and it could be a multitude of different reasons, can't it? Past injuries, traumas, wear and tear, aging, degeneration, repetitive daily habits, movement, sports training. For whatever reason, sometimes these workload percentages, they begin to become unbalanced, don't they? And so what are we going to do with this information, right? How are we going to be able to teach people how to move more effectively based on their anatomical structure? Well, if we want to teach people how to move a little bit better, the first thing we got to do is at least talk a little bit about what's actually moving us, which is our muscles, right? Our muscles do the job of moving us around planet Earth. And so we got to ask a very simple question here. You know, what do muscles really do in a body, okay? And that's a very simple question, and it actually has an equally simple answer. Muscles really only do one thing, don't they? They just pull on bones. They pull bones together and they pull bones apart. That's all the muscles really do. In a physical sense, obviously there are other physiologic things going on and stuff like this. But in terms of the physical relationship with our planet, that's all muscles are doing. They're pulling bones together, they're pulling bones apart. But if you want to take that one step further and think about, okay, how effective is a muscle going to actually be at doing that job of pulling on bones? Well, then there are two critical things that must be considered. Number one, a muscle must have a solid foundation to pull from. Okay, and a silly example that represents this that I usually use with my patients or my athletes is I say, look, imagine if we're going to get in the game of tug of war, right? You're a muscle, I'm a muscle, we're going to grab onto that rope like it's a tendon, and we're going to pull, okay? The only catch is you have to play against me standing on one foot. I get to stand with both feet securely on the ground. That's right, I'm going to beat you every single time. Even if you're bigger and stronger than me, even if you try to pull harder than me, I'm going to win because you have no base of support. You have no foundation to create force production and leverage from standing on one foot. And I know that's a silly example, but it's very applicable to the way muscles operate in our body. If a muscle has a solid foundation to pull from, it can generate a lot of force and power very efficiently, and it can do its job well. If a muscle doesn't have a solid foundation to pull from, guess what? It feels like you did trying to win a game of tug of war on one foot. Doesn't matter how big that muscle is, doesn't matter how strong it is, doesn't matter how hard it contracts, it simply can't do its job as well as it could without a solid foundation to pull from. Okay, so that's the first thing muscles need. But that's not all. Not only do muscles need a solid foundation to pull from, they also need a good position to pull from. How can we start to develop a very high quality rehabilitative program based on knowing these things, right? In terms of really teaching people how to move specifically for their anatomy. And so one of the first main things it comes down to here is this concept that we call building movement. So building movement is the idea of taking large, complex motions and movement mechanics and breaking them down into component pieces. And then we take each of those component pieces and we break them down into further component pieces. And then we take those pieces and break them down into even further component pieces, and so on and so forth, until the most basic fundamental piece of human movement is reached. And now, if we can do this successfully, then we have a clear roadmap of human movement from the highest, most complex movements the human body is capable of producing, all the way down to the basic, most fundamental level.